bad breath, unfortunately, is seen as a cosmetic issue, so it's a personal hygiene problem, and it's no different to, say, someone turning up to work every day and not showering. Unfortunately, we have not got to the stage where we can have a distinction between a illness and a cosmetic problem.
And so if that's getting so bad that the boss is having to pull you aside and mention it to you, or your workers are staying away, then what does that say about how we deal or how we handle such problems of personal hygiene?
We handle them extremely poorly. There is such a stigma attached to bad breath that's why we have started promoting Dobbin Bad Breath Week. We had to get a light-hearted approach where people could own up to their own problems.
Do you think we will?
No. I'm the supreme pessimist.
Now, here's a very simple question. Well, it might be simple, but a serious one for all of us. How can you tell if you've got bad breath yourself?
All right, look, there's a couple of signs. Most people that have bad breath would have a bad taste in their mouth because they would be tasting the sulfur compounds, which are the smells of bad breath. So, number one. Number two, the easiest way is take a spoon, put it to the very back of the tongue where you almost want to bring up your breakfast, scrape it down the tongue and smell that coating and see if that coating has an odour. 90% of the problem is coming from that tongue coating. So if that's got a smell to it, then you've got a problem.
But if you do that, isn't it always going to smell bad?
No, this is the whole thing. Bacteria are very simple creatures. They're the ones that are making these smells, and they need 12 hours to get into a little colony that can start to break down and make the odours. So if you clean the coatings away every 12 hours, you don't have a smelling coating.
Oh, so we should be doing this with a spoon every day, is that right?
Well, that's simplifying it to a degree. Because the tongue has papilla, you need to actually use a gel, brush it into the tongue and then scrape it off. But a spoon is better than nothing. I mean, basically 90% of the problem is tongue-related.
Okay, so what does cause bad breath?
Bacterial imbalance. So bacteria that live already in the mouth, the normal bacteria, are taking the proteins they're finding in those coatings on the tongue, the gums, and if you've got any sort of mucus problems at the back of your throat, they break the proteins down in the waste product they give off the actual smells.
So if you, say, drink a lot of coffee or if you're eating a lot of processed foods, will that contribute to bad breath?
Coffee will, because coffee, soft drinks and things like that will change the environment of your mouth, making it more acidic, and the acid seems to stimulate the bacterial growth.
All right, so coffee's a bit of a no-no and the drinks. What about things that we can do to improve our breath?
All right, a couple of things. If you don't snack between meals but you have 3 to 5 set meals a day, then basically you're going to not increase acid content in your mouth. If you can avoid your coffees and your soft drinks or minimise those things, you're going to decrease acid attack. If you were to chew a sugarless gum, there's a dental one called Recaldent. You can use extra as long as they've got the xylitol in them for 5 minutes after eating. That increases the saliva, and that's the body's defence against bad breath. And then the big one is cleaning. It's not about cleaning your teeth. It's about basically cleaning your tongue with a toothbrush and a tongue cleaner, not the back of a toothbrush. Flossing your teeth at least once or twice a day, and if you have any nasal problems, using a saline nasal flush to remove the mucus from the back of the throat. So it's about a protocol.
Now, if you're somebody that has, teeth that don't get cleaned all that often, or maybe you've got, problems at the back of your gums and all that sort of thing, will that contribute to the bad breath as well?
It will definitely be a collection of bacteria. So if it doesn't contribute, directly to the bad breath, it will in the future because the bacteria will be, collecting there. So you have to have those sorts of things sorted out. Okay.
And Dr. Jeffrey Speiser, this is probably the trickiest question of all. Should you tell somebody if they have bad breath?
Yes, you should. Unfortunately, no one does, and that's why we've brought in this website where people can go and take a quiz, and if they're then dob themselves in.
I'll give you that web address in just a moment. But I guess it is, I suppose if it's someone that you love, it's easier to tell than if it's just someone who sits next to you at work and might turn around and say, oh, you know what, your breath stinks. There are tactful ways of telling someone, isn't there?
There are tactful ways, but you know what? Sometimes being very close to someone, it's probably harder because you then have to live with that person every day. Amazingly enough, your introduction, turn over and breathe on the person, if you were to do tongue cleaning before you went to sleep, directly before you went to sleep, you would find that your morning breath would reduce by 80%, just a simple cleaning of your tongue. So there's sort of some of the things. But telling people is extremely difficult.
Oh, look, it is, but it could be a good thing to do. You might actually keep them in their job or
Well,
strengthen
that's right, that's right.
relationships. Yeah. Look, good to talk to you this morning, and good luck with the week.
Thank you very much, Michael, and look forward to seeing some of your listeners take our quiz. No one has passed it yet.
No.
You have to get 80%.